Hi, I'm Jill. I've been working here at the clinic since the turn of the year, so February 2019.
Hi, I'm Jo. I'm one of the partners here at Adam Smith Podiatry. I've been working with Adam for 7 years now, so it's been a few years, but I'm really enjoying it.
Hi, I'm Adam. I started the business and I'm one of the partners with Johanna.
So when I was at school, I had quite bad pains in my legs. I'd been in and out of hospital for blood tests, x-rays, and no one knew what it was. And I went to a podiatrist with my mum when she was having her feet done. And she just watched me walk in and wiggled my feet around a bit. And she just said, yeah, it's growing pains. Give me a nice big sheet of stretching exercises. And that was me, pain-free. So it really fascinated me how just watching me walk and testing my joints and wiggling my toes, as I thought at the time, just was able to give her such an easy diagnosis.
I had a lot of foot problems when I was younger. I was born with club foot. Both my parents were nurses and both my parents told me not to become a nurse. So I always figured I'd end up in something kind of healthcare or helping people. So I just happened to be up at one of the job fairs when we were at school, and I got talking to a couple of podiatrists. One of them, Chris Lord, ended up becoming my manager for a while when I worked for the NHS. So they started talking about podiatry, what it was. I only went up to the stall because nobody else was talking to them at that time, and I just fell in love with it. My mum arranged a visit for me to go and work with a podiatrist in her practice, who again I worked with when I worked in the NHS. Never looked back. It's just such a varied and such a brilliant profession. There's so many things to do. I just fell in love.
So what got me into podiatry? When I left school, I went straight on to Napier University and did a 4-year degree in sport and exercise science, which was really great and I really enjoyed. During the degree, we worked a lot on sports injuries or rehab or getting the performer to perform at their best. So by doing so, we worked a lot with physiotherapists or podiatrists. We did gait analysis and some biomechanics, and it really interested me and really spurred me on to think, oh, this is something that I really want to go into. So I took a bit of time as that first degree ended and went back and did another 4 years at Queen Margaret in podiatry. And it's great. So it's developed all that interest in biomechanics as well as all the routine stuff that we do in clinic every day, and I really enjoyed it. So it was a great step for me to make, even though it was a full 8 years at university, but that's another story.
I kind of prefer the more gory things than the girls in the filling clinic. I love ingrown toenail, a nail surgery. That's one of my favourite things to do. Wounds. I treated a lot of wounds, particularly when I worked in NHS, seeing all sorts of things like gangrene and all the way to bone in feet. I love that kind of thing. But sports injuries is really interesting to me, watching how people can have pain in a knee and hip and how it can be related to just a locked joint somewhere, how you can resensitize muscles in the leg, how you can reactivate a weaker muscle somewhere and just get them walking again, how the core of the body, if the diaphragm isn't working properly, how you can just get somebody to breathe properly, how to get them functioning, and that'll get hip walking and everything starts coming back to normality and they get out of pain. I find that really satisfying.
My favourite part of podiatry, obviously, as I said before, the MSK, the biomechanics, someone coming in with a sports injury or a general injury, foot pain, leg pain. I love to try and implement a plan of action, a rehab plan, thinking about things like orthotics. All that side of podiatry I'm really interested in, and that got me into the career in the first place. However, I love every day in the clinic. I love routine patients. I love a good old getting rid of a corn and someone getting out of my chair feeling pain-free and happy. That's a great feeling. In the last couple of years, I've really enjoyed children's podiatry, what we would call Podiatrics, and that's the growing foot and how children walk and the way their foot develops over time. So I'm really into that at the moment, and it's something that I wish to develop in years to come.
I would like a bit of everything, but I think my favourite is routine podiatry. I love getting people in, hearing about them, having a chat with them. I like nothing better than a nice big thick fungal nail or lots of hard skin. I find that really satisfying to get people standing up afterwards and go, oh, my feet feel so much better. So I like the routine aspect. That's my favourite. So we've been doing a lot of training this year, all of us. Adam and I have been doing the next part of our acupuncture course. So I'm really enjoying that at the minute. I'm really enjoying using that as part of everyday routine treatment. It's nice to see good results with that. I'm quite interested in going a different route. So I'm looking into doing a course on forensic podiatry, which is looking at footprints at crime scenes or CCTV footage. So that's my next aim, is to try and get signed up for that sometime next year.
So the next steps in my career, hopefully, next year I'm enrolled at Staffordshire University to develop my children's podiatry, the study of podopediatrics. I'm doing a couple of courses with them to hopefully specialise in that area and treat more children and treat foot pain or foot problems in children. So I'm really looking forward to that. In the last 6 months or so, we've done a few courses in dermatology, so skin conditions and picking up odd lumps and bumps of the skin, and I found that so interesting. So again, that's another avenue that I would really like to go down and specialise in over the coming years. So there's a lot of different aspects of the job that I love and a lot that I'm looking forward to develop.
Not entirely sure. This year we've done quite a lot. I've done a course with one of England Rugby League's top physios. So he's actually in Japan at the minute, so I've been doing a course with following his steps and running his clinic and how he, from a physio perspective, looks at a lot of the injuries we treat in clinic, which has been interesting. A lot of our acupuncture, me and Johanna have done a lot of that. Dermatology is one of the areas I've always felt I needed to get better at, and we've done a few courses this year on that, so I might actually try and do a bit more dermatology over the next couple of years, but as it stands, I really don't know. And it's maybe not that funny for Johanna. It was the first time she came to a nursing home with me. We had somebody who nobody could control. There was about 4 people around trying to get the client calm for us to go and treat her. I went away and done something else, and Johanna, on her first day in the nursing home, ended up having to treat this poor person, and one of the staff just taking their eye off for 2 seconds, let go of her hand, and Johanna got scratched across the face. Still haven't let that one down. Her reflexes are still terrible. She should still be more aware of her surroundings. I will get her into cricket eventually, so maybe cricket balls flying at her might improve her reflexes a little bit, but I don't hold out much hope.
So probably my funniest moment working was during a home visit. I was doing someone's feet, and their lovely dog fell asleep on my knee, and I didn't have the heart to wake him up and move him, so I was trying to do my work without disturbing the dog, and ended up with horrendous pins and needles, and it took me quite a while to get the feeling back in my legs.
My funniest moment in podiatry, I would say, was I once treated Santa. I shouldn't really say that for patient confidentiality, but Santa once came in on his way to work in December. I had a patient who was a Santa impersonator, and he came in, had the full treatment in full Santa outfit, and it was a bit surreal, and obviously I got a selfie for my kids to take home, so I can personally say that I have treated Santa.